On December 3, 1967, a man's heart stopped beating in the operating theater of Groote Schuur Hospital, and with a single, decisive incision, Christiaan Barnard rewrote the boundaries of what medicine could achieve. The world held its breath as the donor heart, still warm, still pulsing, was sewn into the chest of Louis Washkansky, a 53-year-old grocer whose life would become a headline that echoed across continents and ignited an ethical firestorm that still smolders today. The story began long before that fateful afternoon, in a South Africa still defined by apartheid, yet also by a pioneering spirit in medical research. Barnard, a young surgeon trained under the legendary heart pioneer Dr. Norman Shumway in the United States, returned home with a vision that the heart, once considered an untouchable organ, could be exchanged between strangers. His ambition was fueled by the desperate plight of patients dying of end-stage heart disease, a condition then deemed hopeless. In the early 1960s, heart-lung machines were just beginning to sustain patients long enough for complex procedures, and the notion of transplanting a whole organ remained a fringe, almost sacrilegious, idea. The donor was 25-year-old Denise Dixon, a vibrant typist whose life was cut short by a tragic car accident. Her family, overwhelmed by grief, agreed to donate her organs, an act that was rare and controversial in a country where organ donation was not yet codified. Barnell, the chief anesthetist, and a small team of dedicated nurses and technicians prepared for what they believed could be a historic moment. On that cold December morning, the donor heart was retrieved, chilled, and placed in a sterile container, its rhythm still faint but audible, a fragile promise of life. Louis Washkansky, the recipient, was already weakened by severe coronary artery disease and chronic bronchitis. He had been on a waiting list for months, his condition deteriorating despite the best available medical care. When Barnard approached him with the offer, Washkansky's consent was driven by a desperate hope, a chance to live beyond the palliative treatments that had become his daily reality. In a brief, solemn conversation, the surgeon explained the experimental nature of the operation, the unknown risks, and the possibility of failure. Washkansky's answer was simple and resolute: do it. The operation itself was a ballet of precision and nerves. After an opening through the sternum, the diseased heart was excised, leaving the patient's great vessels exposed. The donor heart, still beating, was quickly positioned, and the aorta and pulmonary artery were sutured into place. The final, most delicate step was reconnecting the left atrium, a task that would test Barnard's skill and the limits of surgical technology. When the clamps were released, a brief pause filled the room, then the donor heart resumed a steady rhythm. The surgeons exchanged a look of stunned triumph. The patient's blood pressure rose, his skin flushed, and the monitors sang a hopeful melody. But triumph was tempered by uncertainty. Barnard had administered an unprecedented cocktail of immunosuppressants, primarily azathioprine and corticosteroids, to prevent the body from rejecting the foreign organ. The science of immune modulation was nascent, and the long-term consequences were unknown. Washkansky's recovery was closely monitored. His temperature spiked, his lungs filled with fluid, and his immune system waged an invisible battle. Nevertheless, after 11 days, the team declared the transplant a success. His heart was still beating, his pulse steady, his consciousness returning. The world erupted in celebration. Newspapers splashed the image of a smiling Barnard holding the transplanted heart, while television screens broadcast the breakthrough to millions. Yet, beneath the fanfare, a chorus of voices raised moral and ethical questions. Critics argued that the donor's consent was insufficiently informed, that the surgery exploited a society fractured by racial segregation, and that the line between life-saving medicine and experimental spectacle was dangerously blurred. Religious leaders questioned whether tampering with the seat of the soul was an overreach of human hubris. In South Africa, the transplant intensified debates about who deserved advanced medical care. issues already inflamed by the nation's oppressive policies. Only weeks after the operation, tragedy struck. On the 18-day post-surgery, Washkansky's condition deteriorated rapidly. He developed pneumonia, a complication exacerbated by his pre-existing lung disease and the immunosuppressive drugs that left his body defenseless against infection. Despite aggressive treatment, his lungs filled, his oxygen levels plummeted, and his heart, though still beating, could not sustain life. On December 21, Louis Washkansky slipped away, his heart still a marvel of human ingenuity, but his body a reminder of the limits of medicine. An autopsy performed by Dr. Christiaan Barnard's colleague, Dr. Henry M. E. R. Mason, revealed that the transplanted heart had remained viable, showing no signs of rejection. The cause of death was traced to severe pulmonary infection, not cardiac failure. This finding was crucial. It demonstrated that the surgical technique and immunosuppressive regimen could, at least temporarily, keep a foreign heart functional in a living human. The autopsy report was published in the medical journal Transplantation and sparked a flurry of research into better immunosuppressants, organ preservation methods, and postoperative care. In the months and years that followed, the first human heart transplant became the catalyst for a global surge in transplantation science. Surgeons in the United States, United Kingdom, and Japan refined the procedure, developing the cuff technique for atrial anastomosis and improving donor organ preservation with cold storage solutions. The development of cyclosporine in the late 1970s finally tipped the balance, dramatically reducing rejection rates and turning heart transplantation from a daring experiment into a routine, life-extending therapy for thousands. Subscribe to the Autopsy Files for more stories like this.